Hello.
Hi, my name is Jonna. I'm a student pharmacist here at UC Farm. How may I help you today?
Hi. So my mom has been experiencing trouble using the restroom. She says that she's really constipated, and I was just wondering if there's anything here that I can get for her.
Yeah, I think there's a couple things we could probably find. I would need about 10 minutes of your time, if that's okay, to just decide that anything I would recommend would be safe and effective for your mom. Is that okay?
Sure.
Okay, if you don't care, we'll just move over here. Okay, so you mentioned that symptoms were the symptoms of your mother. Is that correct?
Yes.
Is there anyone else experiencing these symptoms?
No, just my mother.
Okay, can you tell me about the symptoms?
So she says that she's had the urge to go to the restroom, but she can't go. She's only had one bowel movement in the last week.
Okay, did she say this was accompanied by any nausea or vomiting?
No.
Okay. Can you tell me about the bowel movement she did have last week?
Yeah, so she says that it was really hard and dry, and it was very strenuous and painful for her to actually pass it.
Okay, did she say if there's any blood in the stool?
No blood.
Okay, has this ever happened before?
She can't remember a time this has happened.
Okay, can you tell me when this started?
So she says that it started about a week ago, her feeling constipated, and she was able to use the restroom about 3 days ago. But that's the time that it was really hard and dry. But since then, she hasn't been able to go again.
Okay, is she having pain anywhere?
No pain.
Okay, so no pain or cramping in the abdomen?
No.
Okay, is there anything that she finds that makes this worse?
So she says that eating really high fatty foods, like her favorite snack, potato chips, makes it worse typically.
Okay, anything that has made this better?
She did mention that when she does drink a lot of water in the day, and then after working in the yard, actually, she does kind of feel a little better.
Okay, so all this information has made a big difference, and I think I can find something to help with her constipation. I have a couple more questions.
Okay.
So is she taking any other medications right now?
She's currently on naproxen, 500 milligrams, and she takes two, one in the morning, one at night, for her osteoarthritis. And then she's also taking like a once a day woman's multivitamin.
Okay. Does she have any allergies?
No allergies.
Okay. Does she use alcohol?
No.
Any tobacco or nicotine?
No.
Any illicit drugs?
No.
Okay. I'm going to go talk with the other student pharmacists, and I'll be right back.
Okay.
Thanks.
Hi, how are you?
Hi.
My name is Amina Amsa. I'm another student pharmacist here at Farm UC. I have a suggestion for your mom. Would you like to come talk about it some more? We're going to go in this room, a little more private area.
Okay.
And you can have a seat over here. So it seems that your mom meets all the requirements. She qualifies for self-treatment. So she seems like she's experiencing primary constipation, which is insufficient amounts of fiber in her diet. To fix this, we want to increase her fiber intake, and we're going to recommend Methylcellulose, brand name Citracel. This will eliminate the strain of her using the bathroom and help her stool to pass a little bit easier. So this is intended to treat constipation by increasing fiber in the diet. It'll increase the bulk in your stool, in effect that will help movement in the intestines, and it'll increase the amount of water in the stool, helping easier passage. So the dose that we're going to recommend would be a 500 milligram tablet. And you're going to take 2 of these with a glass of water. You can take it up to 6 times a day, but do not exceed more than 12 tablets. This may take about 12 to 72 hours to work. So since your mom is already experiencing constipation, as soon as you get home, you want to go ahead and have her take it with a glass of water. Should be taken no more than 7 days. If no improvement after 7 days, you want to go ahead and go to the doctor to see if there's any underlying conditions going on. So I have to tell you about side effects because they could occur or they could not occur. So some more common side effects that she may experience will be some gas or abdominal cramps. Some rare but could be serious side effects will be severe diarrhea, severe abdominal pain, some chest pain, vomiting, or rectal bleeding. So if she experiences any of these, get her to the doctor quick. So I've looked at all the list of medications, and there should be no drug interactions, which is great. Just to be sure to let all healthcare providers know that your mom has introduced Methylcellulose into her medication regimen. So like I said before, no longer than a week. No improvement, get her to the doctor. So to have the best outcome with this medication, no other stool softeners or laxative, just the Methylcellulose. And if she misses a dose, take it as soon as possible, but do not double up on doses. That's very important. And remember, she needs to store this maybe in her medicine cabinet, not a bathroom, but just a cool, dry place. And be sure to keep it out of reach of children and pets. So to monitor this medication and see how well it's working, she should make sure that she visually inspects her stool and see if there's any improvement. No improvement, just go to the doctor because there could be an underlying condition. Some additional lifestyle changes could be to increase her water intake, fiber intake, and just to get some more exercise. I can send you out with some more information on these changes that can be done without medication if you would like, along with the number to the pharmacist if you have any more questions. So again, if it doesn't work, get to the doctor quick to get that checked out. So can you tell me how you're going to tell your mom to take this medicine?
So she's gonna take 2 tablets of the methylcellulose as soon as we get home. And then make sure to not use it for longer than a week. And then to try and introduce better lifestyle and dietary changes.
Great. All right, so it seems like you'll be able to help her. What other questions do you have for me?
None at this time.
All right, let's go grab the medicine.